February 1st, 2020, you, yourself, Dr. Fauci, the NIH Director Collins, and at least 11 other scientists were on a conference call to discuss the origins of COVID. A number of the scientists said that they were concerned that COVID was the result of a lab leak at the Wuhan Institute of Virology, and were concerned that a revelation of the lab leak theory would hurt their relationship with China. The CDC Director Redfield testified that he was not invited on this conference call, and he believes because he believed the lab leak theory was possible. 3 days later, on February 4th, 2020, 4 participants on the conference call authored a paper, Proximal Origin, which was sent to you for editing. Proximal Origin pushed the natural origin theory. On April 16, 2020, the NIH director, Dr. Collins, emailed you expressing dismay that the Nature Medicine article, which was based on proximal origin, didn't suppress the lab leak theory, and asked you for more public pressure to suppress the lab leak theory. The very next day, in response to Dr. Collins' request to suppress the lab leak theory, you cited the Nature Medicine article, which discounted the lab leak theory from the White House podium. My question to you, sir, did you cite this article at the White House because the NIH director asked you to suppress the lab leak theory?
I did not do that in response to anybody's suggestion to suppress anything. It was in response to a question that someone asked at the podium. And I did not edit any paper as shown in my official testimony. So you said about 4 or 5 things, Congressman, that were just not true.
Well, we have emails to prove it.
Well, you don't.
Thank you, and I yield back.
I now recognize Mr. Mfume from Maryland for 5 minutes of questions.
Thank you very much, Mr. Chairman. And by the way, no, we don't have it. So I get tired of hearing we've got it, and then when we ask for it, it's not there. We do not have it, Dr. Fauci, and for everyone watching this.
This was a time in history where you got to throw out the first pitch at the Washington Nationals baseball game while Americans were forced to stay home and watch such events that they love from at home alone on their televisions. And what a hypocrisy this picture shows. Here you are without your mask, with empty seats everywhere. Remember the cardboard cutout fans? That was one of the most insulting things to Americans, having to watch the games from home where you got to go and enjoy the game and sit right next to people not following the 6 feet of distancing, not wearing your mask, and everyone else was forced to stay home and stop enjoying life. And your science here, your science is displayed perfectly in this picture where children in school were put in plastic bubbles because of your science, your repulsive, evil science.
Oh, thank you. You're not allowed to speak.
You're not allowed.
Thank you. Thank you very much.
Mr. Chairman, could you have her removed from the
Yes.
Thank you.
Yes,
Please have her removed.
please.
Excuse me, I ask the Capitol Police to escort.
Yep, thank you. She can be removed. Yeah, you can be removed. Actually, you're not allowed to speak.
Your time has
Take your
expired.
Starbucks with you.
Mr. Garcia, Mr. Raskin, you're out of line. Your times have expired.
Even before this committee started, this same member that just went on this rant introduced the Fire Fauci Act and promoted on a podcast saying that COVID was a bioweapon. That is how insane some of these comments are. And I want to quote this. This is a quote from the same member. "I don't believe in evolution. These viruses were not making people sick until they created them. They weaponize these viruses to be able to attach to our cells and make us sick. It's a bioweapon." The "they created them," sir, is you. They are attacking you and our medical community for actually creating COVID that has caused the deaths of millions. And we know that these extreme comments are targeting public health officials across the country. I also want to show you this other comment. Same member who just attacked you. "The Fauci-funded Wuhan lab created the virus." This is so crazy and irresponsible. In this post, the same member of this committee is accusing you of orchestrating a global conspiracy to create COVID on purpose just to make people get vaccines. That you've done this, sir. This same member routinely promotes complete misinformation about vaccines and actually has encouraged the routine prevention of vaccinations that even eliminate diseases like the measles. Dr. Fauci, you've brought together our nation and the world's best and brightest scientists to take on COVID and create a vaccine that works. I want to ask you a question. I want to be crystal clear for the public. You brought together the world and America's best scientists. Do you believe that the vaccine that you all helped create and ensure is safe and effective for the public?
Yes, and its track record has proven that.
And do you also agree that it's saved hundreds of thousands and possibly millions of lives in America and across the world?
That is absolutely correct, and it's very clear that it's saved millions of lives here and throughout the world. The Europeans have done the same studies that we have, and the data are incontrovertible that they save lives.
Sir, and do you think the American public should listen to America's brightest and best doctors and scientists, or instead listen to podcasters, conspiracy theorists, and unhinged Facebook memes?
No, listening to people who you just described is going to do nothing but harm people because they will deprive themselves of life-saving interventions, which has happened. And you know, some have done studies. Peter Hotez has done an analysis of this and shows that in people who refuse to get vaccinated for any variety of reasons, probably responsible for an additional 200,000 to 300,000 deaths in this country.
Thank you, sir, and your entire team for saving lives in this country, and I'm sorry you have to continue going on with these attacks.
What I believe the CDC used for their reason to say 6 feet is that studies years ago showed that when you're dealing with droplets, which at the time that the CDC made that recommendation, it was felt that the transmission was primarily through droplet, not aerosol, which is incorrect because we know now aerosol does play a role. That's the reason why they did it. It had little to do with me since I didn't make the recommendation, and my saying there was no science behind it means there was no clinical trial that proved that. That's just one of the things that got a little distorted in the response to that.